Thumb pain can make you feel old and make you feel like you have arthritis. You know how many people tell me they have thumb arthritis? And I'm like looking at their thumbs, I'm like, I don't think you have thumb arthritis. Well, I'm going to share with you what makes thumb arthritis and what makes thumb pain not thumb arthritis, but it's probably coming from somewhere else. My name is Huang. I'm the owner and certified hand therapist, occupational therapist at Hands On Therapy Services. I don't know why I kind of fumbled that, like I never said that before. Anyway, I get a lot of people who come in and tell me I have thumb pain and my doctors told me I have arthritis, or I think I have arthritis, whatever it is. Let's take a look, right? Because arthritis usually, especially in the thumb, hits you at a later age, right? I mean, I think I've seen it as young as like 50s, but most of the time you're seeing it when they're in their 60s, 70s. Arthritis, you'll start to see the thumb fall into the palm. And so you'll see like this bone right here, this is your metacarpal. This bone right here starts to get big and bulgy, and it's because it's kind of starting to fall and it's starting to stick out. So the thumb starts to fall into the palm and this part of the bone starts to stick out. So you'll start to see some deformity. Can you do something about it? Absolutely. Don't wait, because then by the time you wait, you're gonna end up needing a thumb replacement, and that shit hurts. Anyway, thumb pain doesn't always mean it's thumb arthritis. One of my patients who I'm seeing for something else was telling me that before his injury, he was having thumb pain. Now, thumb pain on both sides, one hand worse than the other. Anytime you have bilateral hand stuff, it is not just in the hands. One of the key problems could be coming from your neck. Let me explain. I know it sounds crazy. You're like, why is this girl telling me that my thumb pain is coming from my neck? Well, what happens with the thumb, right? And it's very specific. It's not like every part of your thumb. Like if you have thumb pain right here, I'm not going to tell you it's like not arthritis, right? One of the things that we do as a therapist is to do what we call clinical testing, and we want to rule in or rule out arthritis. So one easy way to do it is take two bones, squish it together, and grind it together. If it crunches and it causes pain, you might have arthritis. When I do that with my patients that tell me they have very specific thumb pain right here, majority of the time, I don't know you, you don't know me, like we haven't done any clinical testing, so I don't know about your case, but I'm telling you right now, when I work with people and they have thumb pain right here, not here, they're two different spots. Where you have pain can help the healthcare provider, your doctor, your therapist, anything like that, help determine what's going on. People who have thumb pain right here tend to have some other issue, either the elbow, the shoulder, or the neck. Majority of the time, I've been finding them at the neck area. So the reason why I'm looking here at the neck is always because I rule out everything at the hand and the wrist level, and I'm like, okay, well, none of those things are showing a positive that you have it. So let's take a look at your neck, because the neck has all the nerves come down into the hand, and we have from the neck sensory, they're called dermatomes, basically the sensation that comes from your neck down the nerves to your hand, give you sensation there. So some of the sensation you feel is pain, all right? So in the neck, the dermatomes that come down, they come from different parts of the neck, and when you feel it in different parts of your arm, it can tell us exactly where you have it from your neck. So any problems between your thumb and your index finger usually is a C6 problem. C6, C7, and C8, right? So one of the things that I tell my patients is if you have neck issues, they all end up having neck issues. You don't have pain there at your neck, but you have lost some motion or you feel tight. Pain is not the only thing that you feel that tells us that you have a problem there. The pain you feel is here. It's up to your therapist to find the root cause of it and say, where could it be? So if you're hell-bent on being like, my thumb hurts right here and it's only right here, then go ahead, try to fix it. And if you tried everything else and it has not helped, that's because that's not the root cause. I've had people argue with me, and it's okay. Like, you don't have to believe me. If you keep believing that your thumb can only hurt here, then by all means, do that. But you're probably still watching about 5 minutes in because you've done the thing, you've done the massage, you've worn the splint, you've gotten the injection, and you still have thumb pain. Well, consider this might be a neck issue. So one of the things I always describe when I'm talking about necks, right? So your neck bones consist of 7 bones, and imagine it's up here. And then your neck bones sit on top of your thoracic bone, which is here. And those 2 set of bones sit on top of your lumbar bones, right? That's your lumbar spine that sit here. In order for you to be able to make a fist and to open, to move without any pain, right, is that all of these bones must move the most that it's supposed to move. Everyone's body moves a little bit differently. So I'm a hypermobile person. I move a lot. Look at my fingers, look at my thumbs. I can touch my thumb to my forearm. I'm not going to do that. It's like a freak slideshow thing. But I have a lot of motion. So what happens with someone who has a lot of motion is that I need to have motion in all of my joints to feel good. I have to have those motions in my spine. I have to have the motion in both bending forward and in extension backwards, and then certain parts of my bones rotate, right? So your necks rotate, it bends to the side, and then I have bones here that also rotate, my thoracic spine, and bend to the side here. So when I work with my patients, if they have thumb pain and I can't, usually people come to me by the time they're like, Huang, I've already tried this, I've already tried that. And most of the time, people already had a surgery somewhere else. The doctor said, you need surgery. They have the surgery. It doesn't help. So then by the time they come to me, then we're trying to avoid a second surgery. So if you want to avoid all surgeries, let me know, my link's below. But if you tried massaging, if you tried stretching, if you tried wearing a splint and it didn't work there, just know that it could be somewhere else. So one of the things that I look at is I rule this out first, and then I come up to the elbow, and then I come up to the shoulder. And one thing I'm looking for is for the shoulder to move really well. If the shoulder's not moving really well, then what happens is the muscles of the shoulder put strain on the muscles of the neck, because the muscles of these 2 are intertwined and play together, right? So you got to look at the shoulder. I'm going to show you what I do from a spine perspective today in this video, because it really does, affect your thumbs. And where people start to think, oh my God, I have arthritis, I'm old, and I have to die and be in pain. You don't. And it's funny because hands make people feel really old. Like when they look at it, when they feel it, it's pervasive. It's like every day, because you use your thumbs for everything. It's 50% of the work of your hand. Whoops. So one of the things that I do is I will look at how someone's spine moves. So let's take a look at how your spine moves. So let me take a step back. Oops. Oh, let me just pick this up before I trip on it and break something. Knock on wood. All right. So one of the things I'm looking at is I want to look at how much rotation I have. Where do I feel tightness? Do I feel tightness on the opposite side, or do I feel tightness on the same side? You have to do it yourself. I can't see you, so you're looking and feeling for yourself and saying, one thing that you can't see that I usually see when I'm working with someone is when they turn, they'll move their body. Don't move your body. The other thing is we're going to look at ear to shoulder. Don't hike it up. I just want to look at motion like this. And then I always tell my patients, close your mouth and then look down, close your mouth and look all the way up, right? So we want to look at motion. We want to say, are you tight? You don't have to have pain. If you don't have pain there, don't look for pain. Just look for, does it feel tight? Have I lost some motion? And then I will look at thoracic rotation. So I sit for this and I rotate. See how your shoulder is supposed to disappear? That's how much motion you're supposed to have, right? And everybody, most people miss that motion because they're really, really tight and they don't have enough motion. So I look at that, and then I'll look at how someone extends, goes all the way back, and then hands on the thighs and slide all the way down. So I'm looking at all of the motion, and wherever we see that you're lacking motion, that's where we work. And majority of the time, you might not be, when I promise you, I tell you every single patient that has this problem, I'm like, hey, I know this sounds weird. I know it sounds weird. I know it sounds a little wonky. You either want to help or you don't want to get the help. But I know this sounds weird, but am I okay to look at your neck? So when I look at their spine, I'm like, you might be a little tight somewhere. let's move. So I'm going to share with you 2 movements that I share with my patients, and we get started to see, like, is the spine tight, and if we loosen it up, can we fix it? And that usually is the thing that starts us to finding the root cause, right? This is not the end all be all, but it is the start, okay? Literally just did this with a patient of mine yesterday who came in and his thumb was killing him. And we're like, okay, let's do this and see, because I already know he has neck issues because he's like 80. So hands on your waist like this. If you can, this is a more advanced position. But if you're here, you're not more advanced. You just leave it here. And you can do this with a counter or a table that's steady, just for safety reasons. Do this at your own discretion. But you're gonna put you want your feet, your toes to be forward, and you want your feet to be shoulder width apart. So you have stable, solid support on the bottom. You're gonna put your hands here and you're gonna bring your hips forward and then look forward. Oh my God, that feels so good. And you're going as far as you can go. I just go a lot because I have a lot of motion. You go as far as you can go. Don't let it hurt. It's not supposed to hurt. If it hurts, then you can stop. You don't have to do anything you don't want to, right? You want to keep your knees straight and you want to lean back. And I always like to do it tucked. I always like to tuck my chin in, because that's a bonus. It moves your neck in the way you want it to, okay? So it's fine if you want to look all the way up like that, but most people have a very stiff neck. And so when you look up like that, you can kind of hurt your neck, and then you won't see the benefits of what I'm talking about. Believe it or not, it doesn't matter to me. You can try it, right? You can do 10 of these, all right? Oh my God, I'm actually a little tight, so this is gonna help me. So you can go as far back as you can go. Do 10 times. So if you're a little bit on the younger side, just do 10 times. If you're a little bit on the older side, you do 10 times, but later on you can do what we call a sustain. So just hold it a little bit extra, right? So that's exercise number 1. And after you do about 10 of them, do another set of 10 and then check. Oh, my neck is a little looser. Oh, it is a little bit looser. I could do a few more. I can get my motions back really quickly, but you might need a few reps. But check it, and then you can check your thumb and see, oh, did it get better? If it did get better, then it's a little bit more involved than you think, right? But hopefully that just helps you to have some hope and to think about it in a different way than, oh, it's just arthritis. Arthritis, I need an injection, right? I'm here to help you. If you're trying to avoid injections, if you're trying to live more healthy and more active without needing all this surgery, if you're finding this and it's too late for you, sorry. Sometimes it is too late. You waited so freaking long that now you need surgery. Who knows? I can't tell you because I don't know, but you want to go to someone who can help you figure that out. So that's exercise number 1. Exercise number 2 is thoracic rotations. So you want to sit for this because you want to lock down your lumbar spine, and then we're going to move our thoracic spine. Hands on chest, just relax. You're going to twist to one side, come back to the middle, twist to the other side, come back to the middle. I think this side is my yummy side today. So you're going to twist 10 times to your good side, only your good side. You're going to want to twist to both sides. I'm telling you right now, you can twist to both sides, but we're not doing exercise. It looks like exercise, but we're trying to fix muscle imbalances. That's the difference between like exercise, personal trainer, whatever, blah, 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 versus, like professional therapy. We are trying to fix problems. And so when you're doing exercise sometimes to both sides, you fix the muscle imbalance and put that sucker right back in. That's what I tell my patients. So you're gonna twist only to the good side, work that out, and check on your thumbs and say, oh, is my thumb a little bit better, right? Try it out. It's better to do it with a professional than to do it alone, because I always say extra eyeballs, right? You can't see yourself, but when you go somewhere, they have extra eyeballs looking at you, making sure you're moving correctly. Just because you're doing this exercise doesn't mean you're doing it correctly. But check that out and try it out. Let me know if that helps. Thumb pain, very specific thumb pain in very specific locations is an indicator that there might be something else. So hopefully that helps you kind of be a little bit more thoughtful and not necessarily just rush to injections and surgeries. I don't know. Let me know. Like it, subscribe, leave me a comment, and I'll see you in the next video. If you need my help, my clinic information is below, and we're located in Miami. That's it.